Well, let's go to the Health Hub Times Square in Ballincollig, where I'm joined by Anneliese Dressel. Good afternoon to you, Anneliese.
Good afternoon, Patricia.
Like the rest of us, fed up with the rain?
Absolutely. I can't remember the last time really that I actually was able to walk to work for a week without it raining once.
No, it's just, it is miserable. Anyway, let us press on with questions that have come in for you. Hi, this is a question from a listener for Anneliese, please. After receiving a fall, I have very bad bruising around both eyes and my nose. I'm in my early 60s. Any solutions, please? And there's nothing worse like walking around with two big black eyes. I know, I'd say it landed on your nose, I would say, and you get that blacking under the eyes.
And you constantly feel like you have to tell everybody, I fell.
Yeah, yeah.
And that makes them even more suspicious sometimes. So, yeah, no, it's horrible. So what I'd recommend there is arnica to take it, homeopathic arnica. You'll get it in any health shop, and they come in little kind of pilules. They're suitable with all medications. And you just put one in under your tongue and dissolve it. And you can also buy arnica gel. So what I would do with that is keep it in the fridge so it's nice and cold, and I would apply that quite regularly throughout the day. And that would really speed up the healing time. You could also take vitamin C, which is a great one for skin health as well, if you really wanted to. But that's not going to do a whole pile to speed up healing. It'll just, I suppose, help with the skin. Yeah,
that arnica gel, I always have a tube of that at home. It's great for any bruising.
Oh, it's brilliant, Patricia. And my favourite one actually is the Walida arnica massage balm. Yeah. And I would rub that in it to any achy, sore muscles, or if I've gone out for a big, long walk, I might even put a bit of it into the bath. So it's lovely even for tense muscles around the neck and legs. It's a lovely one as well.
Yeah, it's great. Okay, we've another question. Anne in Clashmore has been diagnosed with a low blood count. She said, what's the best way to treat this? She has started taking Floridex. She also was a big fan of yogurts and wonders, is there any yogurt that contains iron that you might recommend?
Okay, well, no, there's no yogurts. Well, there'll be a tiny bit of iron in the yogurts. There will be iron in cow's milk for calves, for the calves. So there will be some iron in, but there's no high iron yogurt as such. So when she says she's a low blood count, I presume she means that her iron is low. Because you can also have low white blood cells, low red blood cells. You can have low platelets. So I presume in this case, if she says she's taking iron, it was that her iron was low. And a lot of people, I think, especially as we get older, we get less efficient at absorbing iron. And some people are just very poor, full stop, at absorbing iron from their diet. So I would definitely recommend, if you could possibly have liver, maybe once a week. That's one of the best ways of getting a lot of iron into you. And your liver will store some iron, so that'll just top up your own natural stores. And then in terms of iron supplements, there are definitely some that are better than others. And I know that most people would be recommended to take Galfer, but actually of all of them, we get the worst feedback on Galfer. It is a very difficult to absorb, and people will end up with terrible constipation or diarrhea and black stools, which is a real sign that you're not absorbing the iron. So the ones that we recommend mostly are ones called iron bisglycinate, BISGLYCINATE. It's a really, really gentle form of iron. And for our customers, it's brought up their iron faster than any of the other ones. So I know Maconta do one, Viridian have one, Terra Nova do one, so you'll have no problem getting that form of iron. And then the last thing I'd recommend is a product called Hemaplex, HEMAPLEX. And this is just an amazing product. It's everything possibly in there that you need to build your red blood cells. So it's got your B12 and all the other B vitamins, folate and vitamin C, and everything that you could possibly need to build your red blood cells. So if it was your red blood cell count that was low, that's the product you need.
Okay, hi. A question for Anneliese, please. I had surgery on the middle of my tongue last Friday. Now, it stopped bleeding, but it's still very sore. I'm finding it difficult to swallow food and drink. Also, my eardrums and jaw appear a little bit sore. I would really appreciate any help. On your tongue, what would you recommend for a tongue?
Well, what I'd recommend again is the arnica for healing, because surgery will have, affected all the muscles and the tendons as well as the tissue. So arnica can definitely speed up the healing. And then I suppose even just maybe sucking on make sure you boil the water first though. So boil up the water and put it into ice cubes. Sucking on a cold ice cube would probably give you a little bit of relief, and it would also maybe numb the tongue and give you pain relief that way as well. So arnica for healing, I definitely would recommend vitamin C and zinc there, because that would help the tissue knit back together. And there's a lovely herb called comfrey. If you could get that as a tea, as leaves, you'll probably get it in a health shop. That's the old name for that was knit bone. It's fantastic for knitting things back together like tissue or muscles or bone. And that would improve your healing as well. And then in terms of eating, I suppose I'd take the pressure off the mouth for chewing and make sure no food is very hot, and try and take a lot of smoothies in and get your nutrition in that way, so at least you're managing to get the calories into you, because that will also make you feel whacked if you're not eating well.
Yeah, have as a liquid diet as you can for a while, and get well soon. I mean, it's just an awful place to have a surgery done on your tongue. It must be so uncomfortable.
So sore. And Patricia, you know, people who get terrible mouth ulcers as well, that's what it's like. That open sore in your mouth is very, very difficult.
Yeah. If you even bite your tongue, you know, by mistake.
Yeah.
Oh, it's cruel. Okay, Liz wants to know, can you take vitamin zinc with cod liver oil? Can you take vitamin? I'm assuming it's just, can you take zinc with cod liver oil?
You can, absolutely. Cod liver oil sometimes would have vitamin D in there as well, so maybe she meant to say vitamin D and zinc. Zinc, you would get some zinc in cod liver oil for sure, but possibly not a lot. We do get zinc from seafood and seaweed and anything that comes from the sea. But I think particularly when it's the oil, it's been extracted, so it's probably quite low in zinc. So it is a good, safe one to take. But I never recommend taking a very high dose of zinc. I don't think it's a good idea. So I think 15 milligrams should be the most that anybody ever takes of zinc. Okay,
stay on the oils. What is the difference, and how can you compare cod liver oil to omega oils? What is the difference?
Okay, so they all come from fish, whereas cod liver oil specifically comes from the livers of cod, and that would be the old traditional type of oil that we would have grown up having. And I suppose it's the whole product, really, because basically they just take the oil from out of the liver, so it hasn't been processed really too much in any way. Whereas with the omega-3 fish oils, they could come from a variety of different types of fish, and generally they have been processed in some way to extract the specifically omega-3 out of it. So they tend to be much higher in terms of strength, but because they have been processed, you're possibly missing out on some of the things that's in cod liver oil. So I always love a whole product, Patricia, if it can kind of come from a food, or if it's as close to the food as possible. I love that. So for that reason, I do like cod liver oil. But if you're taking it for therapeutic reasons, like as an anti-inflammatory, or if you're taking it for, brain injury or anything like that, I would definitely go with the omega-3s, because you'd have to take an awful lot of cod liver oil to get the same strength as you would from a good omega-3 supplement. Okay, Caroline is looking for treatment for rosacea. She says there's pus coming from some of the pimples on her cheeks, and it seems to be spreading. Oh. Yeah, awful. So, okay, I can only speak about really what topical products would work there, because like rosacea is so complicated, Patricia. I know that most people who have it would have a lot of food intolerances and stomach acid issues. So what I would recommend is just treat this topically. You could take a probiotic, actually, if you did want to start doing something internally. Take a good quality probiotic. But then what we've found works well for our customers is the Antiac range by Salcura. So they do a face wash, and they also do a spray, and they also do a gel that you could put on the spots. So I would definitely recommend that. Now the spray might be a bit stingy because I know there's tea tree oil in it. So maybe the gel might be gentler while they're, if they're oozing and if they're broken open. But just patch test it first, so you don't get too bad a sting. And then the Rosalique, it's spelled Rosalique. This is a product that we are getting amazing feedback on in terms of rosacea. It's really kind of designed as a cover-up product. It looks like a green cream, but when you put it on your face, it's really good at taking the redness out, disguising the redness basically, and smoothing the skin out. There's also a factor 50 SPF in there, so it protects it from sun damage. And most of our customers would say that it's really helped in terms of healing their rosacea as well and bringing that redness and inflammation down. So that could be a good one to use as well if you have to kind of go into work and you're a bit embarrassed about it. Okay, Catherine woke up yesterday morning very, very congested, and she said her right ear was also blocked. She's wondering, would the congestion have that effect in blocking your ear, and what can she take to relieve all of the symptoms? Yeah, they're all connected, Patricia. Your ears and your throat and your nose, they're all connected via different passages. So that's why Ears can definitely block. It sounds, and actually I've had a couple of customers in this morning regarding ear infections. So, and there's a lot of people with very bad throats around at the moment. So it's obviously some kind of virus. So what I would recommend here in this case, I think there's two things I'd probably recommend. So are you feeling your ear is worse or your other symptoms are worse? So Plantago is a fantastic one for blocked ears and for mucus in the ear. Dr. A. Vogel does the tincture that you'll get in a health shop. It's spelled Plantago, Plantago. But the Mucotone has got a lot of stuff in there that would be good for both, but also echinacea, because I think this is probably some type of a viral thing. So the echinacea would support the immune system's ability to kind of get on top of that virus in the Mucotone. So if you can't get your hands on the Mucotone, the Plantago would do. And maybe if you feel both are bad, you could do both. You could take both at the same time.
Hi, question for Anneliese. My ears are itchy on the inside and behind the lobes, also my eyelids. My doctor has ruled out any kind of an ear infection or an infection on my lid, and he gave me Fusidin cream, which I used sparingly, but it didn't work. I'm wondering any natural product that you could recommend. So it's itchy on the inside and on the eyelids.
Yeah, do you know now, Patricia, I think that's an allergic response to something, and I see it quite a lot. For people who are reacting to sodium lauryl sulfate, which is a foaming agent they add to shampoos and creams and body washes and hand washes and toothpastes. And for a lot of people, they're reacting to that, and it does cause that kind of very dry skin. And it because the shampoo has gone down over your eyes in the shower, and because it's gone down into your ears, it causes that itching. So what I would recommend is switching over to a sodium lauryl shampoo, and actually one that's particularly good for very dry and itchy skin, whether it's on the scalp or around the ears, is the Hopes Relief shampoo. And when you're washing your hair, you could just wash it in and around your ears and make sure it gets inside the ears or behind the ears, and then just gently put it over rub it over the eyelids, and that could help with that. The other thing for the inside of itchy ears that sometimes works very well for people is the grapefruit seed extract, because if it's a kind of a fungal thing, it can help with that. But I think in this case, because I feel if it's gone down to the eyes, it's more dermatitis than it is actually fungal. So I would definitely go down that route first. And then I'd probably use something like the Dr. Dealish Clare healing cream on the eyes and in the ears, just to speed up healing and to get rid of the itch.
Okay, and a final one here from Rena in Kanturk. Hi, question for Anneliese. I'm 52, 3 years into the menopause. I take Promensil, evening primrose oil and Eskimo fish oil tablets. I'm not on HRT. In the last few months, I very achy joints, elbows and knees. Are there any additional supplements that you would recommend, please?
Okay, so when I hear achy joints and menopause sort of at the same time, I always think that it's more likely to be menopause than it is to be arthritic wear and tear, because it is a very, very common symptom for women with menopause. And it might be that you might need a little bit more than the Promensil, maybe increase the dose of the plant-based hormones to get extra estrogen into. You could also consider going on HRT if that was a possibility for you, the doctor that would prescribe it. But if you wanted to take an additional like a plant-based hormone on top of the Promensil, you could take the Dong Quai, it's spelled Dongquai, or any other kind of soya isoflavones. I know Vogel do one called Menopause Support. So maybe add that on just to increase the amount of estrogen going into your system, plant-based estrogen. And if that doesn't clear up the aches and pains, then maybe consider HRT. And if that doesn't clear it up, it could be wear and tear. So a good sign if it's wear and tear, Patricia, is if it's really in the same place all the time, and if it's in a place where you may have broken, injured, or use a lot. So I would get a lot now on my right wrist, because I would use that a lot more. So whereas if it's kind of aches and pains all over, it is more likely then to be menopausal.
Okay. All right, listen, have a lovely week, and we've bank holiday next week because it's Easter, so enjoy Easter.
Oh, happy Easter.
And we'll talk in a fortnight's time. Thanks for that, Anneliese. Bye-bye. That is Anneliese Dressel of the Health Hub Times Square in Ballincollig. She'll put up all the information and she passed on to us on her website this afternoon, healthhubstore.com.